Nextly, we have the treatment parameters. So, in the treatment parameters, firstly, we have intensity. Now, what is intensity? Okay, so whenever we are treating a patient, like just for example, let's just say I'm giving ultrasound on the patient's shoulder. Okay, when I'm giving ultrasound in this area constitutes of bones, tissue, ligaments, etc. Right? Now, when I'm giving ultrasound over here, different structures absorb ultrasound in different levels. Like bones absorb too much of ultrasound, tissues absorb little less ultrasound when compared to that of the bones, and like you get the point, right? So different structures absorb the ultrasound in different levels. So actually when you're talking about the intensity in the ultrasound of a particular area, we talk it as an average intensity. Okay, we talk it as an average intensity. Okay, now in the intensity we have two types. Firstly, we have the space average intensity and we have the time average intensity. Now, what is space average intensity? So, the average intensity of a specific area is called as a space average intensity. Now, what is a time average intensity? Time average intensity is average intensity over a whole period of the treatment time is called as time averaged intensity. Okay. So, that is about the intensity. And whenever you are selecting the intensity for treating a patient, always remember acute and immediate post-traumatic conditions. Whenever you are choosing the intensity should always be between 0.1 to 0.25 watts per centimeter square. And for chronic and scar tissues, like if you are treating chronic or scar tissues, then the intensity should be 0.25 to 1 watts per centimeter square. Okay, so watts is the unit of intensity. Okay, right. Nextly, we have the frequency. So, frequency we have already discussed. In the ultrasound, we have two frequencies. We have 1 megahertz and we have 3 megahertz. So, depending upon the depth of penetration or the area that you are actually wanting to treat, you will actually go for 1 megahertz or 3 megahertz. If you are treating the deeper areas, then you will have to go for 1 megahertz. And if you are treating the superficial areas, then you will have to go for 3 megahertz. Okay. Next, we have the mode. So, in the mode of ultrasound, there are two different types of modes. First one is the continuous mode and second one is the pulsed mode. So, coming to the continuous mode, as the name suggests, in the continuous mode, there will be no intervals, okay, there will be no time intervals and there will be this transfer of the intensity or the frequency throughout the time that you have set. For example, let's just say your treatment time is 2 minutes, okay, and you have gone for an intensity of 0.5. So, this 0.5 intensity will be given continuously for 2 minutes. Okay, there will be no breaks or pauses in between. Okay, coming to the pulse mode, however, this will not happen. It will be completely opposite. Okay, you will have various intervals, like you have 1:1, you have 1:4, you have 1:7. The thing is, here in the 1:1, what will happen is for 1 millisecond, you will have an interval of 1 millisecond again. Okay. I hope you are understanding. 1 millisecond, the current will pass into the patient's body or the ultrasonic beam will pass into the patient's body, and for 1 millisecond, there will be a pause. No current will pass into the patient's body or the ultrasonic beam will not pass into the patient's body. In 1:4, what will happen? For 1 millisecond, the ultrasonic beam will enter into the patient's body, it will pass through the patient's body, and for 4 milliseconds, there will be a time interval or a time gap or pause, also you can say. Okay. Same applies for 1:7. For 1 millisecond, there will be transfer of the ultrasonic beam into the patient's body, and for 7 milliseconds, there will be completely no traveling of the ultrasonic beam or there will be this pause. Okay, this is also called as marked space ratio. Okay, so this 1 millisecond, wherever the current is passing into the patient's body or the ultrasonic beam is passing into the patient's body, this is called as marked, and the other half, like the other 1 or 4 or 7 milliseconds where the current is not actually passing into the patient's body, it is called as the space where no current is actually passed into the patient's body. Okay, so that is important. So we have two modes, which are continuous mode and the pulsed mode. In the continuous mode, what is happening? There is continuous travel of the ultrasonic waves into the patient's body. In the pulsed, however, there is no continuous traveling of the ultrasonic waves into the patient's body. There are time intervals where the pauses are taken and there are rest intervals given, and the ultrasonic beam is not actually transferred into the patient's body. Okay, now the actual question is, when do we use these modes? Like what conditions indicate what mode? Okay, so when you're choosing the continuous mode, always remember that more heat will transfer into the patient's body. How? The thing is, we'll go back to the same example again, the 0.5 intensity for 2 minutes. Okay, so what will actually happen in the continuous mode for 2 minutes? Completely this 0.5 intensity is passing into the body. That is, let's just say, so we'll just go back to the same example, which is the 0.5 intensity for 2 minutes. Okay, so what actually happens in the continuous mode, in 2 minutes, throughout the 2 minutes, this 0.5 will pass into the patient's body. 0.5 intensity will pass into the patient's body. But what actually is happening in the pulsed mode, let's just say I've gone for this 1:4 ratio, okay, wherein for 1 millisecond the intensity will pass into the patient's body, and for 4 milliseconds there will be rest. Okay, now what will actually happen here? For 4 seconds, for every 1 millisecond, there is this gap of 4 milliseconds, okay, where the current is not actually passing. So gradually what happens in the 2 minutes, the complete 2 minutes, the patient will not receive the ultrasonic beam. He'll only receive it after each 4 milliseconds, okay, and also he'll only receive 1 millisecond after every 4 milliseconds, okay, whereas in the continuous mode, continuously this 0.5 intensity has been given to the patient. So there will be more heating in the continuous mode and there will be less heating in the pulsed mode, okay. I hope you are understanding what I am saying, okay, right. So, as there is more heat being produced in the continuous mode, what we'll actually do is, we'll treat musculoskeletal problems, okay, like muscle spasm, we'll treat such conditions in the continuous mode. And coming to the pulsed mode, we'll go for the soft tissue repair, okay. So, that is when the treatment modes are indicated, okay. Next is reflection of the ultrasound, okay. We have already discussed, when we are taking ultrasound, like when actually two different mediums are taken, there will be reflection of the waves, okay, there will be reflection of the waves. Now, the same thing happens with the ultrasound also, we have discussed earlier, right. So, because of this reflection, we are supposed to actually not place the head of the ultrasound in an angular manner, we have to directly place it straight away on the point wherever we are treating. That we have already discussed. So, that is something you will have to remember over here. Next, we have the reflection of the ultrasound, okay. So, earlier we have already discussed that actually the sound waves do reflect when they are passing through two different media. So, that is what we have discussed earlier. So, whenever you are treating a particular area, you will have to place the head of the ultrasound on the area that you are treating, and you are not supposed to place it in an angular manner. That we have already discussed earlier, okay. Here again, I just want to remind you that this reflection actually occurs in the ultrasound treatment also. So, whenever you are treating a patient with the ultrasound, whenever you are placing the head, there is a chance that there will be this reflection of the ultrasound waves into the air. Now, what happens when they actually travel into the air? They cannot travel within the air because the air doesn't allow the transmission of the ultrasonic waves. So, what happens? They'll just come back into the head of the ultrasound, okay. And one more thing here you have to remember is there is something called as acoustic impedance. Now, what is acoustic impedance? The acoustic impedance is the ratio that is present between the reflected rays and the transmitted ultrasound interference, okay. This acoustic impedance is very important. This is because the lower the acoustic impedance, the higher will be the transmission of the ultrasonic waves, okay. So, that is something very important to remember, okay. Next, lastly, we have the testing of the apparatus. Now, how do you actually test the apparatus? I'll say. So, you cannot actually see the ultrasonic waves in the air. So, testing the apparatus is very important. This is because you cannot actually see the ultrasonic waves in the air. So, before treating a patient, just make sure to check your machine. Now, how do you actually check this machine? Okay, you can check it through two ways. See, firstly, take a tub, fill it with water. Okay, fill a tub completely with water. Place the ultrasonic head into this container, okay, into this tub or container, okay. We have our head over here. Now, here just take a metal plate, okay. Just take a metal plate. So, when you turn on the machine, what actually will happen is the ultrasonic waves will travel from the head. They fall on this metal plate and they reflect upwards, okay. They reflect upwards. And what they'll cause disturbances in the water, okay. they'll cause disturbances in the water. This is a sign that the ultrasound machine is actually working. Okay, this is one method. The second method that we have is we actually take the head of the ultrasound, we'll add some drops of water onto it. See, if this is the head of the ultrasound, we'll add water. Okay, this is the water. Okay, we have added water. We'll turn on the machine. Will turn on the machine, and what will happen, this water that is present on top of the head, it will start to move, it will start to vibrate. Okay, that means that the ultrasound is working. If the water doesn't move and it just stays still, then that means that the ultrasound machine is not actually working. So that is how you actually test your apparatus, through two different methods. You can go for anything which is easier for you to do. Okay.